My name is Dr. Shawna Nesbitt. I'm a hypertension specialist based in Dallas, Texas. We should always start with me. Start with what you can do on your own before you think about the next strategy, which is to engage the medical care system. The one gift that I have given to multiple family members until they told me to stop is a blood pressure cuff. Because it's a gift for the family that everybody in the family can use. It also allows you to get the earliest time point of when it's starting to go up. That's the most powerful time to actually intervene. So that, I think, is an easy thing that we can do, and it's not a terribly costly one. The second thing we can do is to really be more diligent about what we eat. It's clear that salt in the diet actually has a bad effect on blood pressure. It is even more potent in blacks than it is in other groups. The truth is that we don't eat more salt than other people, but the salt affects us more potently than it does others. Paying attention to that, reading the labels on food, trying to stay below 2,000 milligrams of sodium per day. Paying attention to our physical activity. Our physical activity lags behind every other ethnic group and every age group. Black women actually tend to have the lowest activity levels. And so really paying attention to that. It's okay, I'm gonna park a little further away from the door of the store so I can get that walk in. I think it's helpful in families is to build good habits as a family unit. Build in a balanced diet, teaching kids about having, fruits and vegetables, 4 to 5 servings per day. I don't think most of us do that. I mean, we get adequate numbers of potatoes, but we don't get green vegetables and fresh fruits. And those are really helpful to lowering blood pressures in a natural way. Watching your weight. And so keeping your weight closer to ideal is always going to be healthier for you in every aspect of your life. The second part of it is engaging and having your yearly exam with your doctor, and then having conversation with your doctor, actively participating, because your lack of actively participating in anything tells the other person that it doesn't really matter to you. So asking questions, no question is too small. You're paying to be there. If you're unsatisfied with the answer, ask it again. Spend a little time preparing. Read a little bit. Reread everything else on the internet. It helps you to understand, and we find that individuals who understand have a much higher likelihood of following through. Find a doctor that you connect with. Now, it is true that the concordance of having an African-American doctor with African-American patients seems to turn into better outcomes. However, that isn't necessarily 100% true. What you do need is a relationship with your doctor, someone that you trust, someone that you can talk to, and someone that hears you when you have a problem. That can be anybody from any background. Medications matter. You got to take the medicine. And if it's a problem, then, call back and say, hey, this is not working. This side effect is happening. Is there something else we can do? There are lots of medicines now available. So wearables have become, it's a standard of the game now. Everybody's got a cell phone, everybody's got a wearable. I spend a lot of time looking at what does that mean and how does that affect blood pressure? There are a number of different devices that are just entering the field that have good track records that can be very helpful. Now, the imperfection of a device that is here on your wrist that doesn't measure blood pressure traditionally like we do on the arm, obviously, if we looked at that, we're going to find clear differences. But most of what's useful about these devices, A, is tracking physical activity. Clear benefit. Tracking heart rate, clear benefit. Tracking whether or not you have an arrhythmia, meaning atrial fibrillation or your heart is beating out of rhythm. They're very good for that, because that might be the first place that you find out, hey, my heart rhythm is going crazy here. What's happening? It takes you to the hospital. You may prevent a stroke. Tracking blood pressure can be helpful, but not as perfect as heart rate can be. And so you might find that those numbers are not perfectly correlated to the blood pressure you do in the doctor's office or even on your arm device, but it will tell you a trend. It will tell you your blood pressure runs higher at this point. Go check it to make sure that it's not running too high. And honestly, there are newer devices, and some of them have shown to be much more appropriate and accurate in their correlation to the blood pressures that we measure on the arm. There have been a couple of studies that have been done nationally to look at the acceptability of them. And in populations of African Americans, 60 or 70% have said, you know, if I could afford one, I would like to have one and I would actually use it. And so affordability is honestly one of the barriers for these devices. But as we think about, you know, how healthcare insurance can help us, that's a place where they could begin to think about providing those devices in some capacity for measuring blood pressure that helps us to be a little more conscientious about, you know, all of these risk factors that we are, you know, coping with all the time. All of those aspects of our lives that have an effect on our health. So that is housing, it's education, it is income level, it is accessibility to healthcare insurance in the US where, you know, that matters a lot. It is food security, meaning access to food within a mile distance of your home without transportation. Having a job, employment status matters. Having a partner, especially as you reach older ages, what we have found is that not having a partner actually is a negative risk factor for survival for older individuals. Where you live, and interestingly enough, if you are African American living in a neighborhood, being poor has an effect, but being Black has more of an effect. And living in a poor neighborhood or a non-poor neighborhood is almost the same for Blacks, where it's different for whites. If they are poor themselves and live in a poor neighborhood, then their risk is higher for having hypertension. So there's a lot of detail that is important to understand about how where you live, how you live comes into play with the risk of having high blood pressure. Access to care is a major issue. I won't belittle that at all. It isn't everything, but if you don't have it, then the limitation is even if you know that you have a problem, getting that addressed is like crossing an ocean, right? Unfortunately, a lot of people who have access to care don't use the access to care that they have. I think still we're at a point where we are bargaining with ourselves between a cool pair of sneakers and paying that premium. You know, the sneakers can't wear themselves. If your feet don't work, right, you can't wear them. We've positioned healthcare wrong. We think of healthcare as a luxury item. It's not a luxury item. It's a right to live, right? You know, we all need healthcare. We are all going to have a time period when our bodies do not work well. I don't care where you come from and who you are. But as we think of it as whether you deserve it or not, as a society, we're always going to leave people out. The access to care improved with the Affordable Care Act. It has yet to be shown to improve care in elderly people, only because Medicare still has a gap, and covering that gap in healthcare is still a problem. And so people still have to pay more money to try and get all of their medications covered unless they can afford a higher level of insurance care. We have to prioritize health as an important part of, you know, our lives earlier. And the earlier we prioritize it, the better we're going to be, and is really making that, you know, it's a basis for you. It's like having housing, having healthcare is just as important. Those things should go together for you, and not be something that you put on the shelf and say, well, maybe next year I'll do this, but I'm going to go get these shoes right now. We've got to think about it differently.